The use of GLP-1s to help patients achieve weight loss goals is now ubiquitous, but can these medications also be used to support transplantation? Doctors Babak Orandi and Guarav Gupta are here to weigh in. Thanks to you both for your time today.
Thank you. Thank you.
All right, Dr. Orandi, I want to get started with you. It seems like the uses for these medications just seems to grow and grow. Originally intended for people with diabetes, then we're kind of seeing it for general weight loss. Now, the world of transplantation.
Yes, we're definitely seeing more and more uses for these medications. There are trials now in showing that it can be very effective in sleep apnea. This class of medications can be used for peripheral artery disease and a lot of other conditions that are very common in our transplant population. So we've shown recently that it increases likelihood of transplant, increases long-term post-transplant outcomes in the kidney setting. And so, yes, we're seeing, just like in the general population, where more and more people are using these drugs, we're seeing in secondary transplant populations as well.
And Dr. Gupta, when we're talking about people that are on waiting lists or, potential candidates for transplantation, how big of an issue is obesity or people that are overweight?
It's possibly the biggest issue that we deal with in end-stage kidney disease. So, for example, from what we know, close to 40% of patients with end-stage kidney disease on dialysis are obese with a BMI of about 35. And in many centers, that may be where they don't do transplants anymore. In many centers, the cutoff is 40. So ultimately, we have a very large population of patients who are being excluded from transplants because of body weight.
And are you seeing patients die on the waiting list because they don't qualify because of their health?
I think the answer to that is possibly yes, but we don't know for sure. One of the big black holes of data collection in the National Transplant Registry is patients who are not listed for transplant. So we don't know what happens to those patients, really speaking, but if we look at the overall mortality of dialysis, we can very easily guesstimate that it's significant without transplants for this population.
Dr. Orandi, is this a situation where it's just patients who are in need of the organ that are put on these medications, or is it also a situation where you're utilizing these drugs for living donors?
I try not to use them for living donors because donors that lose weight to be eligible for donation have to keep these medications going. And if they don't, they run the risk of gaining that weight back and developing all the problems that we were trying to avoid in the first place. And at least the way the system is now, these medications are really expensive. These medications need to be taken for life, and there's no clear we don't have a clear system of how that's going to be paid for, who's going to pay for it, and even if insurance pays for it now, it may not forever. There are plenty of instances where payers decide that they're no longer going to pay for it because the costs are ballooning. And then once people age on to Medicare, the way Medicare Part V is written, that it actually excludes payment for weight loss medications. And so people who had coverage when they turn 65 may lose that. And in the setting of having donated, that can be really problematic.
In utilizing these drugs, have you found any unintended side effects or complications with anti-rejection medications or any issues with prescribing these medications?
So generally speaking, these medications are pretty well tolerated. From what we've seen, that patients who are at least on not ultra high doses of these drugs, they tolerate them pretty well. So generally the side effects are some nausea, some vomiting, some constipation, some early satiety, meaning feeling full quickly, but also some worsening of esophageal reflux symptoms, heartburn. That we do see being a bit of a problem because one of the drugs that we use for transplant is mycophenolate, and it may worsen those symptoms. But it's not an insurmountable problem. So in general, these are very well tolerated drugs.
There are a few other things that we do need to think about for patients with diabetes. There is an increased risk of developing diabetic retinopathy when they take these medications, not because of the medication itself, but because that they're so effective at improving blood sugar control. And when that happens too quickly, that can actually precipitate retinopathy in the eyes. And so that's also true of insulin. If you correct someone's blood sugar too quickly with insulin, it's been reported after pancreas transplant, and it's been reported after bariatric surgery. So it's something that people do need to watch for.
Is the use of these drugs within the transplantation world relatively new, or is this something that it's been happening, they've been being utilized, we just haven't been talking about it?
Yeah, so I think the use is increasing rapidly. So in Dr. Orandi's publication from the very recent past, they found that over a period of 10 years, around 6,000 patients were taking these drugs over that period. And those patients actually had a reduced mortality. They lived longer compared to patients who were not on these drugs. And they had an increased access to transplant. That data stops in 2021, so we expect that since then there's an even higher population on these drugs. I think we'll have to study this more to know how many. Speaking for our center, we have a lot more patients today than we did 5 years ago on these drugs. The primary issues are really about access to these medications because of the cost of them.
Right. So with regard to kind of how this is revolutionizing the transplantation industry, it seems like it's making a lot, it seems like it's growing the candidate population, and granting people a lot more access to organs.
Absolutely. And I think in the long term, there will be a lot of potential living and deceased donors that are on these medications. That deceased donors end up being healthier in the long run because of these medications. That'll take some time for that to sort of trickle through, but we may end up seeing that because the use of these medications is growing so rapidly.
Well, it's bringing with it great promise for the world of transplantation. Thank you both for your time today and for all your insights. Appreciate it.
Thank you.
Thank you.